Hello, and welcome to Your Health Matters. Let's Talk. My name is Cleopatra Stali. Now, Your Health Matters Let's Talk is a monthly discussion program focusing on priority health issues that affect us in our daily lives. Now, Zambia as a nation has made extensive progress in recent years towards achieving the Millennium Development Goals. The Zambian health system continues to improve, and access to services is also increasing. However, a number of health issues persist. One critical issue is high maternal mortality. And so on this episode, we are discussing health facility delivery. Help me welcome my guests on the program. Mrs. Imasiku Monde, the Principal Nursing Officer, Maternal and Child Health at the Lusaka Provincial Health Office. And just next to Mrs. Imasiku is Dr. Nambao Mary. She's the Acting Deputy Director, Mother and Child Health at the Ministry of Community Development, Mother and Child Health. Welcome to the program. Now, before we go straight into the program, here's a short clip on health facility delivery filmed in Luangwa District.
Sinarikuzotika pena ninga nkalina mwana panthawi yameneyi. So nezegaza mwezi wamene ubwera ndi pamene ndizaenda ku hospital. So mamene chinachitika chabe mavundu mu kuchabe. Naingomvera chabe nauka kuseni nali bwinobwino kusebenza ntchito zonse bwinobwino. Tawe pang'ono chabe namvera mala mwamba no baba. So ine pamuzi panali bena abantu. So ine nikungena mnyumba ntawe pang'ono na mwana nabwera abadwa. Manje pena nabadwa mwana sana lile. Panapita kanthawi kuti abwera alili. Nabwera na manga neka mwana uyu. So kunali boni tandiza. So pa kupita ka time naona kuti vakulu vija sivichoka placenta. So chamene nachita ine panali ka mwana pa nyumba. Na kumuza tienda uende kunyumba kwa chite uone kapena babwera. So jamwana naenda wawaona na kuvaitana na kubwera. Nichana ta mwana wa bado chabe bwino koma nsenze alira msanga. Manje walira kumanga na manga. So manje vuta mine ilipo. Naona na blood yambochoka magazi. Ero vakulu sivina choke. So mamsanga wa jamai anakamba chili bwino tiende ku hospital ku clinic. So ananitenga pa wilba. Paga nafika kuno ku clinic. Zona mwamwai a doctor tinapeza. So unozona ananitandiza pa kufikira vija vintu vachoka.
In her experience, she suffered returned placenta and a tear during delivery. Because of the tear during delivery, she bled a lot, meaning she lost a lot of blood during the process. She developed dehydration. And because of delivering at home, the child has developed some effect of some kind of a pause, where she hasn't reached the milestones as expected. We are working hard that we educate the community, they understand the importance of them at the facility and the dangers.
Nankana mimba, nankana mimba, mbwela mwauka mimba, napapila pa nyumba, mwana pana badwa, nabalika na ntambo, ndinali pombe mkosi. So zinali pombe pa jana zao lila chabeka mozi, basi wamina kunali kuenda kwake mwana kunali kufa kwake. Amnao tinzinaanza upapisha nao sanali kuzoka ntwali konse.
Ine chinalengesa kuti madamu apapire ku nyumba. Ninali kuyopa chifukwa namvera mbiri yokamba kuti amafuna zambiri maningi ku clinic kuja afunika nkhala wokonzekera kagulidwe ka vintu. So mali mopapira pa nyumba inapezeka kuti anapezeka na problem ikulu maningi. So ni chintu choipa maningi. Ndiponso mukazi ngati wapezeka anapakati chifunika pa 3 months wayamba kuyenda kuchani kuchipimo.
So nawana kamba ya benati ngaonkana mimba sinzakaesa kupapira kuno kunyumba nzakapapira ku clinic. So nabwezapo futi nankana mimba mwauka mimba na bwana uza boss na mimba mwauka anakamba tete ambeko clinic. So basi njepiti nabwera kuno clinic hapa nankana mwana mwamuna na papa bwino chapa.
As for the chief, he has also been very instrumental, where he has also talked to the community that they should not deliver in homes, because there are complications, of course, when someone delivers at home.
I discovered that most of the chiefdom, people were giving birth at home. The health people took me and tried to help, ask me whether I could help to sensitize the subjects, which I gladly received, and I went around sensitizing people in the villages. I made a timetable to visit every village in my chiefdom to stop mothers from dying because of not going to give birth at a clinic or hospital. Then I went around again in the villages. I said, first, every pregnant woman should go for antenatal, accompanied by the husband.
Pa birth plan yatu kamba kuti chikonzekero cha mwana tiza kumusanako zamene tinaphunzisana pa first page tinaphunzisana za bwanja
kupasa date yobwera next ufunika wabwera na mankola kupasa ufunika kumu
muli mwezi wa namba 8 so tizakamisana pa ma signs ya labor. Izi zindikiro za bwanja zamene muzi wako
kapena kubaba mimba na kuchosa voterera pamozi kapena tu blood tumono chabe
kapena na msana kubaba muonjezera so mkaonayo masaini nishi ni labor. So manje pamene yapo mwaonayo masaini mungafune kuenda na vandani ku kliniki angakuthandizireni.
Vanonga tandizo kwenda clinic mamete baboti onerera ku nyumba maybe wa elder sister aunties o bamuna bako especially bamuna bako ndio angakupeleka clinic.
Mwamene chifukwa vanhu madeza kama kuti male involvement funika na wewe wazibambo kugwapo poperekezana kwenda ku kliniki.
So apa tizamba umpima kuchoka kumutu tuone paka mendo vonse ngati vili bwino na malaini. And then nzampasa na fansida pa last. So mungapindi mkeko so. So hapa ningampempeko mkaleko mweko fansida.
Muli bwanji? Nimwe mwalandirira kuno ku Longo Boma Rural Center, the Bawad. Sure. Mwatenze bwanji mami? Nchancha vuta. Malamu ba maningi? Okay. Mpemba kwa continental card yani? Sikoma familia. Okusojiza chitika hapa manje zafuna kuti ni mapima Zambia tupimia kwa BP, tupimia scale na temperature. Okay? Ndani wana wa?
Ya kazi wanga wako nyumba.
Sikomo kwambi. Muchitabu ino kwa pelekeza kwa unai?
Okay, sikomo.
Uyu
mwana wanga second born.
Okay, so mwangu batandiza kwa bolisa kwa uno nae mwe?
Neze wanichererera ata mala mayamba na tidekani titamengele kuchipatala.
Mwachitabu ino kwambi because kwa pila kuma nyumba sichabu ino. So zapimpa kwa kwanja mami. Uchite mwana ndolo lako. Okay, kwa sila sikomo. Nzapeleka manje okuleba wati kuna papira titubapime tipitiriza. Okay. So imo muzayembekeze lako pakasiriza ndabwa nikuze livoko nkapo. Okay. So mami mbuye naye neko.
Odi pesa anye.
So nzafuna muchimunga mwankara.
So let us start with Mrs. Imasiku. What do you mean when you say health facility delivery?
Thank you very much, Cleo. For a health facility delivery, we are looking at a medical service where we are providing services to mothers who come to deliver. And in this case, they vary from level to level. They could start from a health post, which is the nearest health facility service. And then from there, they move to a health center. And then from the health center, they can go to a sub-district hospital, then to a first level hospital, second level, right up to the tertiary, which in our case in Zambia could be UTH. But as you go to the next level, it depends on the kind of delivery. So for ordinary deliveries where there's no complication incurred, you find that they could be delivered at the nearest place to their homes. And for example, here in Lusaka, we'll talk for a place like maybe Kanyama or Chawama. And it varies from place to place, where we have services that will provide emergency obstetrical care with a skilled delivery or attendant. And then there, if there's any complication, we should have immediate referral system in place.
What is this obstetric emergency care? What is it all about?
The government realized that we won't manage to give the equipment, supplies, and train all the staff at the same time. So we said, what can we do? Maybe we can zone these health centers so that at least we are able to offer the care which a woman needs in case of emergency. All the hospitals are supposed to offer these services. And of course, most of the big health centers, which we call zonal health centers, also we've given them equipment, we've given them supplies, and we've trained the health workers in those areas to be able to attend to emergencies. For instance, if a woman comes with a retained placenta, not every nurse can handle that, but we've trained certain nurses who can handle that, and we call that package. It has a number of things which those nurses are supposed to do. So that package, we call it emergency obstetric care.
Now, far too many women are dying during childbirth. Why is this so?
There are a lot of reasons. I can divide into contributing factors and actual causes. The contributing factors, we call them the delays. The first delay is the one where we hope everyone is going to be involved and bring it down. It's the one which happens at the community. You know, for a woman to decide that today I'll go to the clinic, one, they have to know that there's need to go to the clinic. So sometimes they don't have that knowledge. Yeah? The other time, even when they have the knowledge, they have to agree. You know, in Zambia, the man has to say. If the man doesn't agree with your opinion, you won't still go. So they have to be empowered to say, okay, I've made a decision, now I'm going to the clinic. That's the first delay. Second delay is, even if they decide as a community that we are going to the clinic, how do they get there? They might not have transport, they might not have money, maybe the road is impassable. So again, that delays them a lot. The third delay, they might come all the way to the clinic. They reach there pregnant, waiting to deliver. There's no one at the clinic to deliver them because we have staff shortages. The health worker might be there, but maybe they don't know how to handle that case. Maybe it's a complication and they feel they can't handle it at that level. So that will delay again. At times they might even be skilled, but they don't have the equipment, they don't have the blood, they don't have the supplies. So we call that a third delay because a mother has left the community and they've come all the way to the health center, but we are still not able to help them on time.
So what are some of the risks associated with delivering a baby, especially the risk of delivering a baby at home?
Yeah. Now that brings me to the actual causes. Why are these women dying? Because what I was explaining were contributing factors, but there's something that's killing them. And some of the causes were due to bleeding. They bleed a lot. The other reason is the obstructed labor. Maybe the baby is too big or it's not lying in the right way. If it's lying across, again, sometimes that kills our women. Sometimes it's just infection, depending on where they delivered.
What is a birth plan and why is it important?
Well, the birth plan actually is what I think is key to a health facility delivery. So the birth plan takes you through how will my pregnancy be? Where will I access my antenatal care? At what month will I start? where will I go and have my delivery? Within the health facilities, we have this birth plan. It has the 9-month breakdown, starting from the time a woman is 1 month pregnant, 2 months, right up to the time she deliver. The birth plan is basically a tool. It will give you a guide of what you need to prepare in each month. If you haven't yet bought certain things that are required, at least it will tell you, have you bought this? Have you done this? Are you eating this kind of food? You need this rest. And even your partner can actually support you. If they need to help even in the house chores, the birth plan actually is tabulating that. So it's something that reminds the family and the person who's pregnant about how they are going to take care of their pregnancy. You've got the right within the birth plan to discuss with the professional who's attending to you to say, I want a doctor to deliver me. And then even after delivery, maybe I want to decide to stay a week before I go home. You can decide, what does it cost for me to stay in the institution?
As a ministry, what are some of the programs and what are the benefits of men being there throughout this entire process?
Okay. Thank you. Actually, it's not just for childbirth. We want men to be involved in everything, every step the woman takes, meaning starting from family planning before they are pregnant, and when they are pregnant, during pregnancy, when they are giving birth, during childbirth. So we've gone to the community and we've asked them, how can we partner? So they've offered to be volunteers, and we call them Safe Motherhood Action Groups, or SMAGs. If you hear where you live, they're saying the SMAGs, those are the volunteers in the community who have partnered with us to help us, one, to encourage the men and explain why they are supposed to be involved. Like Mrs. Zimasiko explained, all those advantages of men being involved are now being explained by the community itself. And we feel that that's a good move by the government.
These Safe Motherhood Action Groups, are they familiar with the birth plan? Is it readily available at community level?
Yes, indeed. In fact, like Dr. Namba was just said and alluded to, these are community volunteers who are now part of the system of health. And what we do is that we actually give them skills and knowledge on maternity and child health. The things is even for them to identify the danger signs, which is one of the things that comes out on the birth plan. So before even a mother is at risk, the Safe Motherhood Action Groups are aware and familiar of some of these danger signs. It's easier for them to interact with their fellow community members. For example, recently I was in one of the districts where we found that the men did not want to have their wives delivering at the health facility. And when we asked the Safe Motherhood Action Groups, or the SMAGs, we found that one of the reasons is that the men get embarrassed because there's this traditional thing that if a woman has got what the doctor said, an obstructed labor, for example, the baby is lying across and is taking long to be delivered, it's because the man had an affair with another woman. The audience, what do they call it? Yeah.
Remember they call it inchila.
Yeah, you see, he knows it. Yeah. So it's something that is, even in Lusaka, it's known. So the Safe Motherhood Action Groups are actually dispelling those myths and misconceptions, which are quite a number.
Very interesting. Now, doctor, what advice can you give a woman that has just delivered a baby?
When you look at the causes of maternal death and when they usually occur, it's after the woman delivers. Very few women die before they deliver. We have a small proportion dying during pregnancy, a bit dying during childbirth, but most of them, it's after they deliver. And the majority is in the first week. So we'll tell them, even if they delivered at home or they delivered at the health center, they need to be checked after 6 hours, after 48 hours, after 6 days, and then after 6 weeks. So we believe that if the women knew the danger signs and also they were followed up properly, we wouldn't be losing that proportion of women we are losing after they deliver.
And in this period, like Dr. Elia said, we expect similar complications that can occur to the mother whilst they come for the risks that can occur during delivery, meaning they can still bleed even after delivery, or they could have infection, which we can detect early and make sure that they remain healthy and be able to look after their baby. So every mother who delivers is, for example, maybe on the way coming to the facility and they say, oh, well, I've had my baby, so I can go back. We expect them to still continue their journey and be reviewed that everything is fine. And then at the same time, we have mothers who also are HIV positive, and we need to give other instructions after delivery that they remain healthy and their baby are also protected against the transmission of the HIV.
Indeed, that's a very, very good move by the government. Mrs. Imasiku, I'd like to thank you so much for sharing your experiences with us. And Doctor, thank you so much for making an appearance on Your Health Matters Let's Talk. It is now time for questions from the audience. Audience, are you ready with your questions? Yes. I have a very lively audience today. Let's see the hands of those with questions. Yes, so many questions. Let's pick the lady. Please go ahead with your question.
Okay, thank you very much. Childbirth is the process that happens naturally. Why is it necessary to deliver at a health facility?
Yeah, I think I'll pose another question to the audience. What do we say when a mother comes back from delivering in Bemba? How do we greet them? Yes, why do we think they won't come back and we say Mapsuken? It's because we've seen that even when they've delivered in our own homes, we've lost these mothers. The only thing is we didn't know how to stop it, so we thought it was okay. We'll count. If I have 10 children, I save 5, that's okay. The other 5, we won't even name them because they'll die before we give them names. And it was an accepted thing in our culture, but it's not right. So we need all the women to go and deliver in the health center where we can be able to save their children and the mothers as well.
Thank you. Next question.
In some areas, pregnant women tend to walk long distances just to access healthy facilities. And at the same time, there's shortage of mother shelters where they could wait for their deliveries. What can be done to improve the situation? Thank you.
Thank you very much. Mrs. Imasiku?
The government is trying to build as many health facilities as close to the community and families as possible. A woman who's very far needs to be near so that in case of any emergency, they are quickly referred to the next level. Hence, they've also seen the goodness of having a mother shelter. So it's actually becoming a multi-sectorial approach where not only Ministry of Community Development or the Ministry of Health coming in to build these mother shelters. However, in some places, especially the rural setups, we've seen some other village people providing their homes whilst the mother shelter being provided for these pregnant women. So it's something that all of us have to contribute and make mothers be alive.
Thank you so much. Next question, please.
I've heard of some women who develop mental disorders after giving birth, such as depression. I would want to know what causes this and how it can be prevented.
We call it puerperal depression. The cause at the moment is not well known, and they've tried to attribute it to the hormonal changes, but the evidence shows that it's not well known. 1 out of 10 women might develop it. And this is where the woman will just feel low. They'll feel like they don't have the energy to do anything. They'll feel neglected. They won't feel as bad as in puerperal psychosis, where they would want to kill the baby or kill themselves or see things or hear things. No, but they'll just feel isolated. So to prevent it, it's difficult when you don't know the cause, but at least you can help manage it. Because if you give social support as a family, as a friend, as a neighbor, as a church, this helps a lot. But above all, as a partner or as a husband.
Do you have facilities in our country where a woman can access a natal clinic privately without announcing pregnancy to the family or friends? Thank you.
That question dwells on the birth plan. The birth plan will tell you what you want to do, and you can discuss that with the skilled provider. So if you want to have a private antenatal, you can arrange for that. It's something that is starting slowly. You could come in the clinic without anybody knowing that you've come for antenatal, and you go out, because there are many services. We don't only provide antenatal in the clinic. You could be coming for other things, and nobody will know what you came for. but that dwells on if you discussed the matter with the person who's going to provide your service.
Thank you very much. Traditional birth attendants have been delivering women for some years now. Then why are we discouraging home deliveries by these people?
The time we developed a policy to say the traditional birth attendants should not deliver. It's not because we thought they were not important. It's because evidence showed that what kills our women can never be handled at home. If a woman starts convulsing, if a woman develops infection, if a woman starts bleeding, all those things cannot be handled by our precious traditional birth attendants. So that's why we reoriented them and infused them into the safe motherhood action groups and taught them how to sensitize the women instead and bring them to the clinics.
Let's pick the next question.
Thank you. How can I support my wife in childbirth to ensure that health risks to the baby and the mother are minimized?
The first support you need to give to the mother is to ask them to visit the antenatal clinic as early as possible. The earlier they attend the clinic once they recognize they are pregnant will actually help to detect any underlying risks that can be addressed as they advance in their pregnancy. For some, it might need them to be admitted right from the time they are pregnant up to the time they give birth. So as a spouse or as a partner, you need to support that decision. Then at the same time, you need to be asking when they go to the clinic, if you haven't accompanied them, because we're encouraging the males also to accompany their partners or their wives to the clinic each time they visit during their pregnancy or when they're going for family planning or for under 5 clinics once the child is born. You'll be able to hear the information together. There are times that also if you accompany somebody to antenatal, they might be referred to the next level. Instead of delaying them to come back, there and then you know that they need to go to the next level. You won't worry at home to say, normally when she goes for antenatal, she's back by lunchtime.
Well, Mrs. Imasiku and Dr. Nambao, thank you so much for making an appearance on Your Health Matters at Let's Talk. Thank you so much again.
Thank you.
And to you, my audience today, thank you so much for your questions. Very insightful and very, very interesting. Thank you so much. To our viewers at home, we would love to hear from you. Please interact with us on www.facebook.com/MOH Zambia. Well, that's it. That's the program. Your Health Matters. Let's talk.